As 2025 came to a close, so did the Affordable Care Act's enhanced premium subsidies. While the House is expected to vote sometime this month on a Democratic proposal to extend them for 3 years, the effort faces significant hurdles in the Senate.
Ivan Rodriguez joins us live now with more on this effort. Good afternoon, Ivan. What can you tell us?
Brenda, Joe, with ACA enhanced subsidies gone, millions of Americans will likely have to shell out more, and in some cases, a lot more for coverage in 2026 or go uninsured. Another option is finding less expensive policies, but that usually involves trade-offs. Extending the Affordable Care Act's enhanced premium subsidies has been at the center of several battles on Capitol Hill in recent months. Now that they've expired, millions of Americans will have to make an important healthcare and financial decision.
As of January 1st, millions of people saw that their premium payments are going up. Some of them may have already dropped their coverage. Other people may have tried to switch from, say a silver or gold plan to a bronze plan, which would have a much higher deductible, but might keep their premium low enough that they could afford to stay insured.
Enhanced subsidies made Obamacare coverage much more affordable, which helped draw a record 24.3 million people to sign up for 2025 policies. Cynthia Cox is a senior vice president for KFF, a nonpartisan health policy research group. She says enhanced premium tax credits allowed lower-income Americans to enroll in policies with $0 or near $0 monthly premiums, while those in the middle class became eligible for help for the first time. Cox says 4 out of 5 consumers were able to find 2025 plans for $10 or less a month.
Starting January 1st, lower income people have to pay 2 to 4% of their income. Higher income people might have no cap on how much they have to spend. They might have to pay full price, which could be 20, 30% of their income.
Open enrollment ends January 15th in most states, meaning there's still time for people to shop for coverage before being automatically renewed into their same plan. 10 states are providing eligible residents with additional state-funded subsidies that could blunt some of this year's premium increase. California, for instance, allocated $190 million to replace the enhanced subsidies for many of its lowest-income enrollees for 2026. But that doesn't come close to the $2.5 billion in federal enhanced subsidies that enrollees received in 2025. Brenda, Joe?
And Ivan, what's the latest on the House voting to resurrect the subsidies, and what would happen if it is passed?
Well, House Speaker Mike Johnson is required to hold a floor vote on the Democratic proposal to resurrect those subsidies for 3 years. A Democratic leadership source says that the bill has to come up this week under discharge petition rules. Even if the House passes the bill to extend the credits, that doesn't mean the Senate will do the same. And the president would have to sign any and all of those bills. Senate centrists have been working on their own compromise bill for weeks, but their plans are a secret for now.
We'll see what happens there. Thank you so much, Ivan.